Functional endoscopic sinus surgery, or FES, is gaining popularity as an effective technique and a logical concept in the surgical treatment of sinus disease. It consists of endoscopic ethmoidectomies and middle meatal antrostomies. One of the problems encountered postoperatively consists of adhesions that develop between the middle turbinate and the lateral nasal wall. These adhesions may interfere with sinus drainage and ventilation that constitute the rationale behind the whole concept of functional sinus surgery. The middle meatal antrostomy may also have a tendency to narrow and even stenose completely. Some type of stent is needed to prevent these complications. The ideal FES stent should be well tolerated, not be apparent on the outside, be easily trimmed to fit any operative cavity, should not cause significant nasal blockage, should not interfere with sinus drainage and ventilation, should not hinder post-op office cleaning, and should be easy to remove. Boston Medical Products is pleased to introduce the Salmon FES stent. The Salmon stent has been developed using all the characteristics of the ideal FES stent. The Salmon stent, made of radiopaque medical-grade materials, consists of a flat oval base intended to be placed laterally to the middle turbinate. The stent also has 2 fingers extending from the base. These fingers are introduced through the middle meatal antrostomy into the maxillary sinus and help anchor it in the desired position. The oval base may be easily trimmed to fit specific anatomies. The fingers can also be shortened to any desired length. Either bayonet or Hartmann forceps can be used to insert the Salmon stent. Using the Hartmann forceps, the trimmed stent is grasped along the longer axis of the base. Bayonet forceps may also be used in a similar fashion. The stent is inserted by way of the nasal cavity. After the stent has been trimmed and grasped with Hartmann forceps, it is guided through the nasal cavity to the level of the middle meatal antrostomy. The forceps are released and then positioned to grasp the 2 fingers of the stent. The fingers are then guided through the antrostomy into the maxillary sinus. The forceps are removed. The fingers hold the position of the stent. Suctioning can easily be performed in the office. To remove the Salmon FES stent in the office, the nasal cavity is first sprayed with a local anesthetic and a vasoconstrictor. Either a Hartmann or bayonet forceps is inserted into the nasal cavity on the side that contains the stent. The base of the stent is grasped and gently pulled out. The Salmon FES stent is well tolerated, is not apparent on the outside, is easily trimmed to fit any operative cavity, does not cause significant nasal blockage, does not interfere with sinus drainage and ventilation, is easy to clean in the office, and is easy to remove. For more information about this product, please contact Boston Medical Products at 1-800-433-BMPI. Outside the continental U.S. at 508-898-9300. Or visit our website at www.bosmed.com.